So if you're watching this video, you were probably referred by your optometrist, eye care provider, primary care doctor, or a friend or family for cataract surgery at our facility. So my name is Sumit Jindal. I'm one of the surgeons here at New Century Ophthalmology, also known as NCO Eye Center. And right now I'm sitting in the room that you'll probably be getting your surgery in, depending on your insurance and needs. So this is right here, right in our office where we do our cataract surgeries. And now, the purpose of this video is cataract surgery can get, even though it's an overall simple process, can get a little confusing because we have lots of different options for lenses we can use. So right here's a cabinet with lots of different lenses. Before surgery or even on the day of surgery, we'll do lens calculations to get the right powered lens for you, for your needs, for your eye. So my video got cut off there, but so here are a few of those different lens implants options that you have for surgery. So based on your eye health, whether you have conditions such as glaucoma, macular degeneration, cornea issues, irregular astigmatism, previous pterygium, lots of different factors that can impact whether you're a candidate for certain lens implants or not. And so the most common lens implant that we use is just what's called a basic monofocal lens implant. This has a set distance for your vision. So it's going to greatly improve your vision because we're clearing out the cataract and we're putting in a lens implant powered for your eye. Typically, if you have astigmatism, which we all have some amount of astigmatism, when you use a monofocal lens implant, your vision will be much clearer, but you will probably still need to use glasses for most daily tasks to optimize your distance vision and to optimize your up-close vision. Some patients who don't really have much astigmatism at all may not really need glasses much for distance, but you'll definitely need them for reading. And regardless, your vision is going to significantly improve. And so insurance typically covers this sort of lens implant. You may see little facility fees and stuff like that, but this lens implant is a very good one, very solid, and everyone is technically a candidate for this lens implant because it is a lens that is monofocal, as in it's not bending light in lots of different ways. The other option, which probably is, I would actually say the majority of our patients choose this, is some sort of astigmatism correction. And that astigmatism correction can be done in two different ways. One is with a monofocal lens implant that has built-in astigmatism correction for it. So patients with larger amounts of astigmatism, we need to use a lens that has a lot of power in it to correct that. Or if you have you can still have a decent amount of astigmatism, but just not enough that you need a lens to correct it, then we use something called a limbal relaxing incision, which is a specially sized for depth and length incisions on the superficial part of the cornea that help correct that astigmatism. So that is our sort of I'd say the best bang for your buck quality option is correcting your astigmatism, because that is going to improve your visual quality. You will still need glasses to read, but you're not going to have any issues with any further issues in night driving, in seeing glare and halos and rings, or distortions or weird shadows and things like that because of using a trifocal lens, which we'll talk about shortly. So astigmatism correction gets you the best quality vision, mainly at distance and some intermediate, but you'll definitely need to use glasses for fine print, but your visual quality will be top notch. And then another, again, popular lens option is something called a trifocal lens. So a trifocal lens actually has rings in it, and this package doesn't show it well, but essentially kind of like the rings that they show on this logo here. They're these tiny rings in the lens itself that help give you distance, intermediate, and up close vision, and also can provide astigmatism correction. Again, some of those astigmatism correction is it's built into the lens. Sometimes we're doing these limbal relaxing incisions at the same time. And the pros of this lens is for most daily tasks, you may not need to wear glasses at all. You'll be able to read, you'll be able to see intermediate, you'll be able to see at distance. And the con to it is that because of those rings, especially initially for the first 6 months to a year, you're going to really notice some glare and halos around lights. Most commonly when you're driving at night, headlights are coming at you, you'll see some rings around those lights. And you may need some more light to read because, again, the way this lens works is it splits light. So 100% of the light is coming into the lens, and then it splits it with each ring so you can get all ranges of vision. It is a great lens for someone who does not have other issues such as severe glaucoma, macular degeneration, or other retinal issues. If you don't, you need to have very regular astigmatism, not irregular astigmatism. So if you've had a pterygium before, if you have keratoconus, not a good lens for you, and we would not want to put one of these in your eyes. But based on the published data, 97 to 98% of patients, once they reach that 6 months to 1 year mark, are very satisfied with that lens, with this lens implant. But there is 2 to 3% of patients who are not happy with it. They do not like the side effects of the rings and halos. And in that case, we have to do something called an IOL exchange, where we actually go back in the eye, take this lens out, and trade it out for a monofocal lens that can give you some extended range of vision, but you may need to use some glasses. At the end of the day, there are a lot of different options out there for lens implants, but we want to choose what is going to be the best for you, your situation, your needs, your hobbies, your daily activities, and most importantly, keep you safe. So just to refresh here at the end now, 3 main categories. We have a standard lens implant where you'll probably need to wear glasses for distance and up close. You'll still be wearing some bifocals, but your visual quality should be really good. Then you have the kind of mid-tier package where we're doing getting you the best quality of vision by correcting your astigmatism and giving you some depth of focus. That's astigmatism correction either with a lens or a limbal relaxing incision. And then we have our trifocal lenses, which give you all ranges of vision, but with some side effects attached to it. If you have any questions, definitely reach out to our office. We'll discuss more at your consultation with our clinic, with me or one of the other doctors, Dr. Vinodjand or Dr. Samantha Prabhakaran. And you should also ask your referring eye care doc as well, your optometrist, because they see a ton of patients, they refer patients, and they are going to be managing your post-operative care. So they really have a lot of intuitive knowledge on what is going to work well for your eyes, your vision, and your needs.